Through innovation, academic excellence, and family-centered clinical care, Children's Mercy Kansas City is transforming outcomes for children around the world. Welcome to the audio interview series, Transformational Pediatrics, with host Dr. Michael Smith.
Our topic today is innovative interventions for children with type 1 diabetes. I have two guests today. I have Dr. Mark Clements. He is a pediatric endocrinologist at Children's Mercy Kansas City, and Dr. Susana Patton. She is a pediatric psychologist and professor of pediatrics at the University of Kansas Medical School. Dr. Clements, Dr. Patton, welcome to the show. So, Dr. Clements, let's start with you. Let's just kind of run through what are some of those common challenges that we face when we're trying to treat and control type 1 diabetes, and what are the opportunities then with some of the new technologies?
Sure. So type 1 diabetes is a really unique disease among pediatric diseases because the youth and their families are faced with feeling generally well most days, but being told that they have to engage in quite a few self-care behaviors that other kids their age and in their school grade don't have to engage in. And it's really difficult when you feel pretty well to be told that you have to check your blood glucose 6 to 10 times a day, and you have to inject insulin or push some buttons on your insulin pump multiple times a day, and you have to count all the carbohydrates in your food. I think that I read a study once that suggested that there were well over 40 distinct self-care behaviors that people have to engage in with type 1 diabetes. The other problem that we face is that our diabetes education right now is really one size fits all. And we know that families who are caring for a 3-year-old face different unique developmental challenges compared to families who have a 13-year-old, for instance, or boys versus girls. And so we really see a number of opportunities to try to reach outside of our clinic and help improve healthcare self-care behaviors in the home, and also to create a set of diabetes interventions that are more tailored to the unique issues that families face.
Right. And so, Dr. Patton, then that's brought about then this collaboration, right, between the University of Kansas School of Medicine and Children's Mercy Kansas City. Why don't you tell us a little bit about that collaboration? What are the goals?
So I think there was this opportunity for a natural collaboration, specifically between myself and Dr. Clements. We both had an interest in diabetes technologies and in particular how families are using different diabetes devices in their daily management. We both had an interest in glucose variability and how that impacts daily functioning as well as long-term outcomes. I have particular expertise in terms of behavior management, and since so much of diabetes involves helping families learn and then adhere to a fairly, as Dr. Clements described it, fairly difficult daily self-care regimen, there's a lot of questions and a lot of ways that we might be able to intervene to help support these new self-care behaviors and help families to maintain those self-care behaviors. And then certainly Dr. Clements has the expertise and the knowledge about how diabetes is changing, not just what the current picture of treatment is, but then what's the treatment going to be 6 months to a year down the line. So we can also be thinking on how to begin to continue to innovate in our research as well as innovate in the care that we provide or treatments we provide to families.
So, Dr. Clement, how many projects are actually involved in this collaboration?
Well, on the surface, I would say 3, but I think that Susana and I actually have probably more than 10 projects together, if you count all of the small health outcomes projects that we're doing to try to gain foundational knowledge that will drive future intervention development.
Well, if we look at it from, if it's easier to talk then about these projects in the groups of 3 that you mentioned, go through the first one that you guys are working on then.
Yeah, so I'll describe the Tackle Type 1 Diabetes project. And, Tackle Type 1 Diabetes came out of some insights that Susana and I gained in looking at Children's Mercy's own health outcomes data in the Diabetes Center. And we found a signal that suggested that school-age children are experiencing a deterioration in their blood sugar control during the first 2 years after their diagnosis. And this was a little bit surprising to us because we know that as the honeymoon period of type 1 diabetes wears off, that all youth will experience an increased need for insulin, and that as children become adolescents and go through puberty, that they'll experience an increased need for insulin. But we couldn't explain the unique finding that we found in 5 to 10-year-olds that showed a deterioration. And so we started to hypothesize that the children taking over some aspects of their self-care each day, checking their own blood glucose, injecting their own insulin, might provide an explanation. And so we decided to collect foundational data by looking at some detailed information about the parent and the child, how they think, how they behave, and how that relates to their engagement with their therapy over the first 2 years, and how both of those then relate to their blood sugar control over time.
So in that project, when you look at that age group, that what you said, 5 to 10-year-olds, so we see this deterioration there. Are you linking this more back to compliance or is there something physiologic going on?
Well, even further back, actually, we're linking it to things like parent depression, parent stress, child executive functioning, how the child cognitively processes information, and Dr. Patton is really the expert in this area in type 1 diabetes, and is recognized worldwide for her work in this. And so I think the goal is to take this information, find those factors that predict deterioration in blood sugar control, and then develop specific interventions that tries to change those behaviors.
Yeah. Dr. Patton, would you like to share with us another one of the projects that you're working on?
Absolutely. So another project that we have that's underway is a project it's all telemedicine-based, video-based telemedicine. So we are delivering video-based with either through a tablet, a phone, or through the computer intervention to families in their home, and it's all focused on working with parents of young kids. So these would be kids who are between the ages of 1 and 6 years old, and they have type 1 diabetes. And what we're working on is helping families to reduce their fear of hypoglycemia. So in the larger literature, one of the things that we have, Dr. Clements and I have consistently measured as a potential barrier to tight glycemic control, especially in our younger kids, is parents' fear of hypoglycemia, the fear that their child will have a low blood sugar that could be very severe, that could cause other health complications. And because their child's so little, the child may not be able to recognize those symptoms. The child may not be able to communicate those symptoms as well to their parents. And so the parents also have that fear that they might miss all the signs and the symptoms. And so what happens is that families then run their child's blood sugar a little bit higher, because if your blood sugar is a little bit higher, then it reduces your risk. So we're working with families, as I said, with this telemedicine intervention to help them reduce their fear and help them think about other more proactive or better management strategies. So other strategies to manage their child's blood glucose without having to resort to running it high or perhaps undertreating their child's blood glucose.
So, obviously, there's a lot of projects going on, and this is a much larger, I think, collaboration than even I originally thought. So what I'd like to do maybe is to back this up a little bit and start with you, Dr. Clements, and just what would you like physicians and practitioners and even family members and kids to know about these new innovative interventions for type 1 diabetes?
Sure. So I think a lot of the work that Susana and I are doing together recognizes that patients and families really only spend about 0.03% of their waking lives in clinic with us. And it's really difficult to imagine we can have a big impact on their behaviors in caring for diabetes at home if we rely only on those contacts in clinic 4 times a year. And so if we really want to have an impact, we really need digital health strategies and sort of health system interventions that help us to reach out to families between clinic visits and give them feedback on how they're doing and make suggestions for how they can improve care at home based on the specific behaviors and habits we're seeing form outside of the clinic. So I think that that's the message for healthcare providers, is that we've really arrived at an age where digital health isn't a luxury, it's a necessity. And then for families, I would say that we can't sit in our offices and dream up these interventions without them. So several of our projects are really gaining insights from talking to parents and children themselves about what they would like to see in diabetes care. And I think it really speaks to a new partnership that is necessary between the healthcare system and patients and their families to drive innovation in healthcare in the future.
Dr. Patton, what would you like people to know?
I think I'd like them to keep in mind that while we focus on and we try very hard to help all of our patients with type 1 diabetes achieve a good HbA1c, which is our measure of glycemic control, there are larger and related goals that we also have to keep in mind. So making sure that we're doing a good job assessing for fear of hypoglycemia or other anxiety for parents or for patients, making sure we're doing a good job of assessing for depression or depressive symptoms for parents and for kids, identifying problems with conflict that could be interfering with daily behaviors. I think there are many things that we could be doing in our clinics that will also help to support the ultimate goal of helping these kids be safe and healthy and have good tight glycemic control.
Dr. Clements and Dr. Patton, obviously you guys are doing some very important work, and I want to thank you for doing that. And also, thanks for coming on the show today. You're listening to Transformational Pediatrics with Children's Mercy Kansas City. For more information, you go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Mike Smith. Thanks for listening.